Hello everyone, welcome back to my channel. Today's topic is atelactasis, which is again from medical surgical nursing, respiratory illness. Let's get started with the video. Atelactasis is a disease condition in which there is collapse of lungs. Due to some etiological factors, there is collapse of lungs. The collapse of lungs occurs when the lungs cannot inflate properly. It is characterized by shortness of breath and chest pain. Here is a detailed explanation about the breathing mechanism and how alveoli gets filled. When we breathe, the lungs filled up with air. That filling up with air is possible because of alveoli, because alveoli is the air sac of the lung. So now, oxygen is delivered from the alveoli because blood absorbs it from there and then supplied to various parts of the body. In this disease condition where the alveoli is collapsed, there is chances that there will be lack of oxygen in the whole body. So body will be sustaining but in a lesser amount of oxygen. So sign and symptoms occurs because of that. This is a diagram where there is a normal lung in the left side and collapsed lung on the right side. As alveoli forms the volume for the lung, where there is no alveoli, or when there is collapse of alveoli, there is no volume of lung. This can be due to surgery. The most common reason is a surgery. People develop surgery after atelectasis. Because of exposure of anesthesia, many of the muscles of the body becomes numb and involuntary, voluntary, both functions stops for a while due to anesthesia. After recovering from anesthesia, that is after the completion of surgery, if the patient's breathing pattern is not established properly, then the patient might be suffered from collapse of lungs, that is atelectasis. Next etiology can be pressure. If something from a higher pressure outside the lungs hits the lungs, then that can be a reason for collapsing of lungs. Blocked airway can be another cause. Airway can be blocked due to mucus, due to any other physical things, or other lungs condition like disease, pneumonia, pleural effusion, respiratory distress syndrome. These all lungs condition lead to atelectasis. Or if there is a mucus plug due to any disease, where there is development of mucus plug in the airways, either it is after surgery, after any medicine, after any drug, if there is a mucus plug, that mucus plug also might be a reason for collapsing of the lungs. If there is injury, chest trauma due to accident, due to stabbing, then atelectasis can occur. If there is pneumothorax, occupying of air in a space of the chest, occupancy of air in a space of the chest, that is pneumothorax, that can also lead to atelectasis. Scarring of lung tissue, scarring by injury, scarring by lung disease, or scarring by any kind of surgery. Scarring of lung tissue also leads to collapse of lungs. This factor can be older age due to degeneration of tissues. They are prone to atelectasis. Older people are prone to atelectasis. Or any disease condition where swallowing is difficult. So if swallowing is difficult, the food particle might enter the airway and might be a foreign body for the airway. If it reaches to alveoli, atelectasis can occur. The patient which is confined to bed with infrequent position changing, the patient who is unable to change the position has lesser muscle activity that can lead to atelectasis. Some disease like lung asthma, COPD, other lung disease like bronchiectasis, cystic fibrosis might also be a reason of atelectasis. Or if there is a recent abdominal or chest surgery, that might also cause atelectasis. Recent general anesthesia, weak breathing respiratory muscles, medicine, pain or injury, smoking, that might be a risk factor. Pathophysiology can be, first of all, exposure to etiological factors, exposure to surgery, exposure to any kind of medicine, that reduces alveolar ventilation, that reduces gas exchange from the alveoli and to the alveoli. Now, this disturbs the passage of air. The trapped the trapped air in the alveoli is absorbed by the blood, but the air which is outside cannot come into the alveoli. The air which is already present, blood takes the oxygen. Now the alveoli is free. It wants to have some more air, but due to the blockage, due to the collapse, damage or blockage, there is no passing of air to the alveoli. So the isolated portion of lungs, that is those alveoli, become airless and collapse. Clinical features are shortness of breath, increased heart rate, coughing time and again, chest pain, and cyanosis might occur. In cyanosis, skin can be blue and lips can also turn blue. In diagnosis, we can perform history taking. First of all, surgical history is important. Recent exposure to anesthesia or any surgery, any chest surgery especially. In physical examination, we can monitor breathing patterns, rate, depth of breathing. Chest X-ray can be done, MRI can be done, or CT scan can be done to locate the exact place where atelectasis has occurred. Atelectasis does not occur in all the areas of the lungs. It occurs in some of the alveoli, some area of the lungs. Atelectasis can be managed surgically. Lobectomy can be performed so that the isolated part of the lungs can be removed. After that, patient needs to learn how to breathe again. Because patient was previously breathing with a fully healthy lung, now some of the lobes are removed. Now patient needs to learn how to breathe effectively for the whole body, because whole body demands oxygen and lungs is the only center for oxygen. So we can take respiratory therapists for help so that they can train the patients how to breathe. They will train the patient in a certain position and give a certain techniques. They will teach certain breathing exercises to the patient, like deep breathing and coughing. They will perform percussion on the patient, chest percussion. They will perform postural drainage on the patient, and they will teach how to breathe. Chest pressure. The source of chest pressure should be removed by using surgery or medicine or both sometimes. The blocked airway can be visualized by using a bronchoscopy so that breathing can be comfortable again. Lungs condition, any disease condition in the lungs should be treated with medicine or any other procedure so that it can relieve the pressure on the lungs. Complications of atelectasis can be hypoxemia, that is low oxygen level in the blood. Pneumonia, because as soon as the alveoli collapse, there is risk of infection at that site. Respiratory failure can occur at the end stage of atelectasis. Thank you so much. Next topic will be discussed in next video.